So with that, I want to thank you again for believing in us and the incredible support that you've provided to our organization and our mission. And I'd like to take this opportunity now to introduce our next panel. This is the Information Blocking Work Group. It is led by Dr. David Camitta from CommonSpirit and Paul Uhrig from Surescripts. So thank you all for your leadership. And then with the expert advice and support from Mark Segal and Steve Gravely. So thank you all, and please help join me in welcoming them to the stage. Thank you.
Good morning. I guess I'm up. So I'm going to start off by just reviewing the agenda for our panel presentation, which will give an overview of the work that this really fantastic group of people that have come together to try to really peel apart the proposed rule to the ONC, and most importantly, try to determine what's really going to look like in real time and the practical implications. Just being an informaticist, I don't know how to use a clicker, of course. This.
Well.
There we go. So the information blocking work group is really the core workhorse engine of people that came together to engage in this work. So we're just going to present what's happened so far, the perspectives of the ongoing work that we're in sort of like heads down in right now. And then Mark and Steve will go over the compliance and implementation plan framework, and then the next steps, and then some discussion at the end. So we have had a total of 9 meetings. And we convened pretty rapidly for phase 1. We had a very short time frame to get a lot of experts together to provide some thoughtful recommendations out to the ONC and the proposed rule. Phase 2 and then phase 3 are really the most important. And so right now what we've been doing is really going through in detail and not resubmitting sort of like the same comments, but understanding the practical implications, and then, you know, as I always have on the top of my head, perhaps trying to predict unintended consequences out of this. And that's really, you know, sort of like policy meets practicality. So how is this, you know, and I think we've all been thinking about this, and we've had a lot of experience in trying to understand that. And then the other charge is to really the ongoing discussions, and that's phase 3. And I think that is really also probably equally, if not more important, that once the final rule is out, to actually understand how that's working and have this same group of experts who've been there from the beginning really provide feedback and a great forum to do that. And so I just want to call out the amazing breadth and depth of people who have come together, again, voluntarily, who all are in their own spaces engaged in this work and have really shown up and had tremendous engagement. And there's just been wonderful conversations and discussions going on in these meetings. So with that, I'm going to hand it over to Paul.
So very briefly, I just want to go over the work that we've done in phase 2 of this project. So as David mentioned, we've had 9 meetings. You can see on the slide there the areas that we covered in each of those meetings. Phase 2 will really culminate in another meeting on the 13th. We're obviously awaiting the final rule, and we'll talk about that a little bit later. But then the results of phase 2 are going to be documented. They'll be provided to all of you, and then of course we will provide them to the public consistent with our mission. So that sort of really closes out at the end of this year phase 2, and we'll talk about phase 3 later on. So without any further delay, why don't we get into the essence of the proposed information blocking rule, and with that I will turn it over to Mark.
Thanks, Paul. Good morning. So what we're going to focus on today is what the work group did in phase 2, which is really the phase following the submission of the comments this past spring. And as you sort of listen to what I'm talking about, recognize that the final rules, both from ONC and CMS, are at OMB. There's a lot of rumors swirling around about when they're going to come out, and hopes it's not going to come out on December 23rd, as I think happened one year. But recognize these rules are coming. They're in their final stages. And so as you're sort of thinking about the discussion, think about it in the context of items that you're going to want to focus on when they finally come out. So there were a lot of public comments on the ONC rule, I think over 2,000, although my sort of ad hoc review is the majority of those actually were on the price transparency provisions in that. But there were a lot of comments, and there were some common themes. Probably one of the most common and consistent is the potential for significant burdens on different actors from the the things that were required both in information blocking and certification. There was a sense that the NPRM should basically be revised and out for a second round of comments, and I think there's continued discussion on that. There was a thought that, because right now, the effective date for the information blocking provisions and some of the certification provisions, I believe, is 60 days after the final rules publication. That's really quick. And as you'll see from my discussion and Steve's, there's an awful lot to do. So there were comments that said, have a delayed effective date to allow the industry really time to resolve, to do what needs to be done. Also, a desire to resolve, or to clarify rather, how the enforcement process is going to work. What's OIG going to do? Or what's ONC going to do? There were also, on the exceptions, there was just a concern that, some people felt that the exceptions were actually too broad, that they basically would provide a free pass for people. Others thought that they were too narrow, and so that's something ONC will have to work out. A consistent view, and you'll see it when we go through the slides, is that the information blocking definition itself was a bit too broad. And that also the definitions of health information exchanges, HIEs and HINs, was too confusing. And also that the very broad definition of electronic health information was somewhat too broad. And then finally, that the provisions around pricing and contracting were potentially too restrictive. So on some of the key definitions, and I'm not going to go through these in any detail, but just to highlight, the definitions are really key. They work together synergistically, and they're all very broad. So you've got a broad definition of information blocking, as I mentioned, of electronic health information, which is broader, very important, broader than HIPAA PHI, broader than the US CDI, for example. The interoperability elements, these are the things that you do, that your organizations do, that affect information interoperability and could be subject to an information blocking concern. very broad set of actions and things that organizations and companies do that are interoperability elements. And then the actors, the 4 categories of actors, and particularly, as I mentioned, HIEs and HINs, and particularly the HIN definition is very broad, and we had a lot of discussion on that. And so specifically, as the work group looked at the definitions, and we focused most heavily on the definitions of HIEs and HINs, one of the things that we thought about, and that I think David raised as we were sort of looking at unintended consequences, and Paul did, is the potential span of groups that could be defined as an HIN, and therefore an actor subject to information blocking and subject to that wonderful $1 million per violation maximum fine. So I'm not going to go through them all, but just a lot of organizations and organization types that might not have been thinking they could be subject to this. So if you're one of those and you didn't think you had to pay attention, you might need to pay attention. So in another meeting, we really looked at the information blocking practices. These are the things before the exceptions take hold that are, things that potentially could be considered information blocking as ONC interpreted the pretty broad statutory definition of information blocking that was in 21st Century Cures. I should also emphasize that as the work group went through this, and I think was said at the outset, we were not looking to redo or relitigate the comments. We're really trying to identify what are the implementation issues that we all need to be thinking about now before the final rules are out and then afterwards. So ONC came up with a number of categories of information blocking. For example, restrictions on access, exchange, or use. Rent seeking, I love that. That's one of those terms that comes from the economic literature. Limiting or restricting interoperability. So each of those categories had a whole series of practices. And I would definitely encourage you to take a look at those, and certainly to take a look at them in the final rule. As the work group went through those, and we sort of asked, well, we had a series of questions for each work group meeting. How did those practices, did they make sense? And I think the sense of the work group, and again, we had a very broad set of perspectives and areas of expertise, that the example practices made sense in the context of the particular categories that ONC used, which themselves really came from the statute. But that there was definitely still some ambiguity, and again, we, and I'm sure many other groups, made comments to try to clean that up. But I think what's critical, and again, this was, a number of folks on the work group made this point, is that the examples that ONC had should really likely be viewed as things that people have complained to ONC about over the years. And in a sense, what ONC did is they took those complaints, again, this is an inference, don't know this for certain, but it's a good guess. They took those complaints, they used that both to inform their regulatory development, but also then categorize them, in the particular practices. So you want to take those seriously, as those are things that, it's not academic. It is very likely that each and every one of those examples is something someone came to ONC about. And so to be aware that these are real concerns that are both within the community, but also that have come to the attention of the regulators. So we asked, did work group members disagree with any of the identified practices? And I'll just highlight a few. One is, there was a discussion around sort of the optional versus required elements of standards, and where people were, not doing something that was optional. And I think there was a feeling that the way that was framed in the regulation maybe didn't accord with, in fact, how optionality, and I think Dee Dee talked about that a bit yesterday in the eHealth Exchange, optionality can cause some challenges in implementing standards, but it's handled in certain ways in implementation guides and by users as they implement standards that didn't seem to fully line up with how ONC had put it together. The issue of that there are multiple federal and state laws in play when you're looking at the issue of requiring consent when consent is not really required by law, and just the recognition that's going to need to be really enforced in a sensitive way. The question of, is a provider's decision, let's say that they've got a vendor and the vendor develops a new interoperability capability, which maybe is available at a cost, and certainly at a cost of implementation and training. Is the decision not to basically acquire something that's out there in the market or offered by your vendor, is that information blocking? And so again, we went through a number of these, and these were questions, some of which I think were probably made in regulatory comments, and we'll just need to be keeping in mind. Were there any examples that were missing? And again, folks from their perspectives came up with a few. For example, if a vendor is charging a provider to develop or implement data segmentation, which are things that they may need for their own regulatory requirements for 42 CFR Part 2, is that information blocking? Definitely a feeling that there needed to be more definition about reasonable costs and fees without special effort. A lot of focus as well on the fact that writing to an EHR, which is not actually part of the certification criteria, that's considered use, which is one of the 3 categories around information blocking. And so sort of how will that play out in terms of enforcement? So we also looked at sort of a couple of related issues, which is the recovering costs exception. And again, some of these were particularly the actual exceptions, which really give life to this. And we looked at both recovering cost exception, which sometimes is viewed as the pricing exception, and then the licensing exception, reasonable and necessary, which is abbreviated as RAND. So one of the questions we asked work group members is did they see that there were additional documentation burdens associated with having to support cost-based pricing? And I think the short answer is yes. They did see that they were likely. That this, for almost anyone involved in pricing those interoperability elements, which is really the issue here, it's just a big change from how things are done now. That the level of burden involved was going to have a lot to do with how broadly those elements were defined. For example, if you're thinking about an EHR, is the focus on the APIs and the interfaces that are used for interoperability, or is it really the whole EHR? As a source of data and as something, for example, to be written to. And that likewise, the accounting granularity, how detailed your accounting has to be of costs to justify your pricing, that the more granular, the more detailed it has to be, the bigger the burden. There's also just a recognition that you may need very detailed information on your clients to justify cost and price factors, because the pricing needs to be for folks who are similarly situated, so you'll have to do that kind of analysis. And because prices are supposed to be grounded in costs, but costs change over time. Costs are recovered. There are new costs that are entered. Well, how often do you have to update your pricing to be related to costs? Overall, the suggestion was made, and this was certainly not a consensus, but it was a point that was made that I think there were probably a lot of virtual nods, that ONC should consider a higher level approach to this issue, really focusing on transparency, on allowing apples to apples, oranges to oranges comparisons, and not focus so much on whether pricing was grounded in detailed accounting. So that was a theme that actually came up for several of the exceptions as we looked at them. We also looked at what were some of the terms in this that were most likely to be a problem. So one was just this issue of reasonable cost, and clearly a view that there needed to be more specific definitions and example. There was some ambiguity of key terms and pricing-related exceptions, and the fact that ambiguity could actually have a chilling effect on business entry and on business conduct. And again, that higher level approach to focusing on transparency could get rid of some of that. We identified a number of issues around how to allocate costs around customers, and I'll just summarize it. You can look at the slide that was felt to be something that was likely to be very challenging in actual practice. We recognize that, particularly in the not-for-profit space, it's very common to do, whether you're an association or an industry alliance, it's very common to do pricing based on customer size, based on member size. And that may or may not necessarily relate directly to cost. That, it can to an extent. It can cost more to service a larger, more complex member organization. But the extent to which sort of how that's treated, whether it's number of beds, number of members, et cetera, that could be a major change for much of the community that focuses on interoperability. We asked about, as we turned to the RAND licensing approach, so we asked our work group members, how familiar are you with RAND, right? Is that something you used in practice? And, it was crickets, right? Not much familiarity. And we did a very scientific, extrapolation to the broader community and thought, there's probably not a lot of familiarity out there as well in the broader community that might have to deal with this. And I think generally that while SDOs, standards organizations, often use RAND licensing as they incorporate intellectual property in their standards, again, it's just not widely used right now. There was also this issue that a lot of software, although it may seem to the customers that there's a fee for it, that in fact it's licensed. And so there was the question of, well, which really applies? Is it the cost-based provision? Or is it the RAND licensing provision? That's something that actually came up in the HIT Advisory Committee. And whether, and again, during those committee discussions, and they carried over into ours, whether there might be strategic decisions to be made of which exception to avail yourself of. There could be advantages potentially to using one or the other. And so that issue of whether you can make that decision itself needs to be clarified. We asked, how long is it going to take for people to review their pricing policies and their agreements? And, I think the short answer, again, is given the likely breadth of the information blocking, it's going to take a long time. There's going to be a need for initial review, which is going to be the big push, but then things are going to have to be reviewed over time. So to sum things up, what are some of the implications for organizational priorities? And Steve and I will get more into some of the compliance and implementation perspectives. But that basically folks who are organizations who are actors or potential actors should be thinking now about issues with compliance and implementation. You don't want to be waiting for the final rule. You need to plan for the worst case. And that's always been the case. We've all been dealing with, proposed rules. You really don't want to be waiting to implement within your organization until a final rule comes out. So what do you plan around? Well, for whatever your worst case is, and it's not going to be the same for everyone, you ought to plan for it. That the more definitions are ambiguous, the more challenging things are going to be. It's going to be more challenging for smaller practices to deal with things. And also just that there's this reality around information access, and we've seen this in the headlines, that physicians, clinicians, and provider organizations, they're going to want to be acting as stewards of their information. That's going to bump up against their obligations under information blocking and the HIPAA right of access. Some organizations are also going to face very high volumes of requests for information. They're going to need to organize around that. And the final point I'll make is just that audits happen, and we saw this with meaningful use. They can happen a long time after you did something, and you can find that you had a liability that you didn't envision. So you need to plan for that, and particularly you need to be thinking about that in terms of your record keeping. So with that, I'm going to turn things over to my friend Steve Gravely, who's going to talk about a compliance framework.
Okay, thanks, Mark. That was outstanding. And Mark and I have had really the privilege of leading the work group through its 9 meetings. And as you can see, there's a lot of ground that we covered. The information blocking rule is incredibly dense, as you know, because you've all read it. You know, it's interesting that we're talking about this. Yeah, well, I know. Yeah. It's interesting we're talking about this now, because it was 3 years ago, in December of 2016, that then President Obama signed the 21st Century Cures Act into law. And I bring that up because I've been in healthcare for over 40 years, okay, right? And I've been a healthcare lawyer for over 30 of those years. But sometimes I think we get mired down in the Administrative Process Act and sort of forget about the fact that information blocking is a federal law. So there is a rule, and that rule is important, as we've just talked about. But at the end of the day, this is federal law. And so for those, you know, we're all in healthcare, right? So for those of us who grew up on the provider side of the industry, you know, we have the Stark Law and the Anti-Kickback Statute and the False Claims Act and a whole bunch of other federal laws that are like living, you know, eating and breathing, and we just don't think about them because they're part of the bedrock. Information blocking is the same thing, okay? And I want to reinforce that point, because I do believe that folks are thinking about this as if, oh, this is going to blow over, you know, it's just another thing, and, you know, so, but I don't think that's going to happen. Which, the reason I think that's important, well, there's a lot of buttons here. The reason I think that's important is because we do have to think about compliance. I mean, you know, all of Mark's points are critical, but just keep in mind the last slide about implications, and I can't do a side-by-side. But if you think about all those implications, everyone in this room and all of your organizations are going to be directly and substantially affected by the information blocking provisions in the Cures Act and by the rule. You know, we all know it's at OMB. It will emerge when it emerges, but it's been designated as economically significant, which means it is expected to have an impact of at least $100 million. Many of us think it will be a multiple of that, but that's a lot of money. So that's all of us are going to be affected by it. So what I'm going to do in the next 10 minutes, 8 minutes now maybe, is talk about a compliance framework, which is what the work group focused on during its last call, and we'll focus on next week in our December 18th call. So why is compliance important? Well, I imagine all of you have compliance programs in your organizations. I mean, I'm not even going to ask for a show of hands, but I'm sure you do. It's hard to be in healthcare today and not have some type of compliance program. But for information blocking purposes, you know, why is this important? Well, Mark said $1 million, and that's per violation. So those add up in a hurry. And so the penalties are quite high. Even in today's dollars, they're quite high. The other reason is that as an actor, and most of you are probably actors under the statute or under the rule, or you're customers of actors, or you have customers who are actors. You know, somehow you are in the orbit. And the way the statute is written, and therefore the rule reinforces this because the statute's written this way, the burden of proof is really on the actor to demonstrate that their conduct fell within one of the 7 exceptions that's in the rule. So now that's different from a presumption of guilt, which is a popular phrase these days. It's not a presumption of guilt, But what it is, if you're accused of reckless driving, okay, then you have the burden the government has the burden of proving that you acted recklessly in driving, but then you have the burden of countering that evidence. And so this is similar. Someone, whether it's the OIG or ONC or someone else, makes an accusation or an enforcement action that you have violated the information blocking rule. At that point, the burden shifts to you as an actor to say, no, my conduct fell within one of these exceptions, and you have to prove that it did. And because of that, in order to prove that, you can't just say it. No one's going to take your word for it. You have to prove it. And so that's why compliance plans are so essential, because compliance plans give you the mechanism to have the data and the evidence to prove that. And so I'm a little bit emphatic, but I think it's really, really important. And then, of course, it doesn't happen by accident. So when Mark and I and Marianne and Paul and David were talking about how do we frame this up for the work group, I said, well, I think we need to talk about frameworks that are out there already. Healthcare compliance is not new. It's an entire industry. And there are people who are compliance professionals, and that's their career. And so what we settled on and what the work group endorsed was using as a possible framework the OIG compliance framework that's now 30 years old. It really came out in the 1980s, before many of you were in the industry. It was a derivative of the US federal sentencing guidelines, and specifically the federal guidelines for organizations that federal judges use to sentence corporations, think Enron. That's really where it all started. And that they use to impose sentences on organizations that break federal law. So this is well-grounded. This is not something anybody made up. This is well-grounded. OIG took those guidelines and in the 80s created a framework for healthcare organizations and published about 15 model compliance plans for the healthcare industry. And that's easily available on Google. So the OIG compliance plan has 7 elements. I'm not going to read them all to you because you can see them here on the slide, and I see a bunch of you taking pictures. The slides will be available to everyone, but feel free to snap away. But they will be available to you. But you can see from these 7 elements that this pretty much covers the waterfront in terms of and probably your compliance plans probably resemble this, right? Because this is it's pretty comprehensive framework. You have to have a written compliance plan. You have to have written policies and procedures. Again, we tend to sort of check that one off, but think about the process right now in your organization, the process that you follow when you either create a new policy and procedure or you amend one, because you do that all the time, and there is a process. Same thing here. You're going to have to follow a process to either create or update your compliance policies for information blocking. And that has a lead time. It may be weeks, it may be months, but it has a lead time. Someone needs to own this within your organization. You probably have a corporate compliance officer. You may have several of them, in fact. You may have an entire division, if you're large enough, where you have a chief compliance officer and a number of deputies and a number of assistants. That's quite common. Or if you're smaller, you may have a person wearing 5 hats. Also very common. But someone has to own compliance, and the list goes on. There has to be a complaint mechanism, a hotline, call it what you will, but there has to be a complaint mechanism for people to bring up to the organization. Hey, I think we're breaking the rules here. Not necessarily a whistleblower under the Federal False Claims Act, and certainly not as it's become popular today, but more of an internal reporting mechanism where people can express their concerns about, conduct that they think might violate the law. But that's a really important part of compliance. And then a feedback loop. Every system has to evolve. No system is perfect. And so compliance programs and OIG recognize this. They have to continually evolve and become better at what they do. So, why pick this framework? There are others. And we're not saying that this is the be-all and end-all, but it's a pretty decent framework. We think, and the work group agreed, we think it's important because it's something that, the OIG is important in healthcare, all right? And the OIG has enforcement authority under the Act and under the rule for information blocking. So how they approach things is probably important. And the whole goal of the compliance plan is to be able to convince the OIG or ONC or both, hey, I didn't violate the law. I fit within exception, I fit within the RAND exception. I fit within the privacy exception. I fit within one of the other exceptions. And here's why we did what we did. And here's why it's within the exception and therefore per se not information blocking. That's the analytical framework for defending a case. Now, and so the OIG framework, like I said, it's over 30 years old. It's well grounded. There's a ton of authority for it, and so I think it's a decent place to start. So let me finish up here by talking about what are some of the compliance challenges that the work group identified. Okay, we know we need one. The OIG framework's fine. Okay, great. And this is really the transition into implementation, which is what Mark's going to talk about, and I may jump in on. But what are some of the big challenges with this? Well, the obvious one is who owns this? Information blocking is different. As you no doubt already know, or as you appreciate from Mark's comments, information blocking cuts across a lot of sectors. It's not necessarily as clean and neat as the False Claims Act, which implicates billing and coding. It's not necessarily as clean and neat as Stark or any kickback, which implicates contracting with referral sources. It's not even as clean and neat as HIPAA, although HIPAA is not necessarily clean and neat. But information blocking implicates your IT folks, your finance folks, your clinical folks, your C-suite in a big way, your marketing and development people. And that's a real challenge in terms of how do we bake this into our, even if you have a compliance program already, how do you bake this in to your existing compliance program? Who gets tapped? Which of your compliance professionals gets tapped to own information blocking compliance? And that's a very important decision. If you don't have a compliance program, and this is the first time you've ever done it, it's equally important. Who's going to be on point here? And so that we think that's a huge issue and one for which we don't really have a good answer, but we know it's an important question. We are very worried, and the work group is extremely worried about the burden. We hear a lot about provider burden, and we should, but we are concerned about actor burden of having to spend resources, time, money, et cetera, on fundamentally building up their compliance programs for information blocking, and we think that that burden is probably understated in terms of the cost. The work group was very concerned about how am I ever going to explain this to my board? Or how am I ever going to explain this to the C-suite? Or how am I going to explain this to, fill in the blank? How do I explain information blocking to fill in the blank? It's tough. It's very dense, and that's not just an academic concern. That's a compliance concern, because all those fill in the blanks must be read in to your compliance program, not only because they're in a position of authority, but also because they have to support this. And this is going to take cooperation and resources. And then finally, how do you balance information blocking against the absolutely obvious tension of protecting the privacy of individuals' information. And I see this all the time in the context of interoperability and information exchange, where well-meaning organizations, usually provider organizations, will be pushing back in the context of a health information network, saying, well, I'm not sure we can share that information because of HIPAA. And it is well-intentioned in most cases. And then you have a dialogue about that. So juxtapose that, and that is pretty old. We've had HIPAA since the early 2000s, 20 years. Juxtapose that now with this mandate to not block information, and you can see the conflict. And that's a piece that's going to make compliance really difficult, I think. So with that, I believe that's it for me. Yeah, with that, I'm going to turn it back to Mark, and we'll talk about implementation. Yeah.
All right. So Steve really introduced a lot of the issues that folks need to be thinking about in terms of implementation. Compliance is a huge part of implementation because you're implementing, for the most part, to comply with your obligations under federal law and regulation. But as you think about information blocking, as you think about the scope of it, it's really a business issue. And so it's going to be important for organizations, whether or not they're an actor or not, to think about it in terms of business risks, business opportunities, business challenges. And so there's a real need to interrelate the compliance planning and implementation planning. This is a topic that the work group has not gotten to yet. We're going to be introduced to it at their meeting next week, and then the anticipation is that a significant part of at least the first part of phase 3, and very much, going to be driven by what's in the final rule, will involve building out a framework for implementation planning that can be available to the membership and to the broader community. And so what I want to do today is at a very high level kind of illustrate some of the steps that an organization would want to go through. Again, as Steve said, this is not the only model, but this is a model based on experience with similar issues. Steps that you'd want to go through to put together an implementation plan and implementation framework. So the first question you need to ask is, are you one of the actors that's subject to the information blocking requirements? And if yes, you really need to create an organization-wide information blocking project. I'd say if you're not an actor, but you deal with actors, you may also want to do this, but I think on a smaller scale. If you're going to be wanting to get data, for example, from an actor. You're going to need to identify the affected teams within your organization. And as Steve said, this is going to be really, really broad. What teams are involved, what staff are involved, including external contractors. Critically, and again, this overlaps with Steve's approach to compliance planning, because of the depth of the risk and the scope across the organization, you're going to want to identify a senior executive that's the project owner or champion. You'll likely want to implement a project management process, a project management office, and establish internal reporting processes, including what happens if a field engineer working on an interface pricing, and somebody says the magic words, information blocking. You want to make sure that gets brought up to the proper folks within the organization. And again, you can imagine each one of these checkboxes can be blown out in detail. You want to identify, designate, and train your internal subject matter experts, and identify external resources, both organizations and people. And absolutely, you'll want to be reviewing, depending on where we are, the proposed and certainly the final rule, the ONC website. And ONC has been putting out just terrific types of information. They certainly did on the proposed rule, and other industry resources, such as what we're talking about today. So my last slide. Again, as part of this process, you're going to want to identify what are the risks to your business, but also what are the opportunities. What are the opportunities that are going to come from the increased data access and liquidity that's intended by this regulation? You want to identify risk mitigators and a risk management model that in many ways is not going to be unlike what we've seen in the medical malpractice field, where there's a well-defined body of sort of knowledge and information. How do you avoid being sued? And so there are just ways. How do you avoid having somebody, go to one of the regulators and say you did information blocking? You're going to want to critically evaluate the exceptions that are relevant to your organization and what are the needed actions by the team to make sure that you meet those exceptions. You want to identify compliance and business actions that will be needed. Again, that's where the compliance plan particularly comes in. And what changes do you need to make in contracts, agreements, and licenses? You're going to want to review your overall organizational interoperability and data access strategy and process. How do you deal with requests for information? How do you balance, as Steve said, the imperative of making information available with protecting it on behalf of your patients, for example, and to assure that you're complying with HIPAA? Related to that, you're going to want to review and update your release of information policies. And critically for all of this, and particularly for the exceptions, you're going to want to have policies, procedures, training on those policies and procedures, and communication plans, both internal to your team members up and down the organization, but also externally. You're going to want to have a public face, right, about your organization's approach to information blocking. And finally, again, where Steve's work comes in, you're going to want to make sure you're integrating your broader implementation plan with your more specific, which is also going to be broad, your compliance plan and process. So with that, I think I'm turning it over to Paul to bring us home. Thank you.
Great, thank you, Mark. So we've talked about the past, we're going to take a future view here. I do want to say we are going to open this up to questions in a few moments. But having talked about the first phases of the information blocking work group, a good summary, a great summary of the proposed rule, let's talk about what is coming next. So as has been mentioned, we are looking for the final rule to come out. Now I want to acknowledge something up front. There are a lot of rumors out there, right? The final rule is going to drop on December 23rd, so we have something to do on Christmas Eve. The final rule's not going to come out. There's going to be a delay. There'll be additional rulemaking, right? The rule will be effective immediately. No, the rule won't be effective till 2022. So as you look at some of the data on this screen and what I'm about to talk about, you may say, well, I've heard something different. So have we. But we needed to base, our thinking on the best public and most official information we have available to us today. Could things change? Of course. But based on where we are today, we do think it's likely that the final rule will drop in December, in January. The proposed rule went to OMB on October 28th. They have a 90-day clock, right? And so unless they extend that clock, we are looking to a January deadline. The final rule is likely going to keep many of the key elements that Steve and Mark have talked about here. Everything that we hear is that it will be effective immediately, or most provisions within 60 days after the final rule is published. So clearly, as Steve and Mark have talked about, people need to prepare for this rule to come into place. As has been discussed, we think there's going to be continued uncertainty here from a regulatory perspective. This is a massive rule, and as has been described, is going to affect many organizations and many parts of those organizations. And as has been discussed, is there going to be tension between privacy and data blocking? Are actors going to be worried if I share the data The Office of Civil Rights or the State Attorney General will be knocking on the door claiming a violation of HIPAA or state law. If I don't share data, is the Office of the Inspector General going to be knocking on my door claiming data blocking? We're going to have to work through this in the coming years, right? There are, Sequoia has brought together great experts. Mark and Steve are two of the best and most knowledgeable when it comes to information blocking. There's probably going to be a scarcity, though, of resources to help all of us get through this. So that's why Sequoia, has been engaged in this mission of convening and informing. So, as I talked about earlier, phase 2 of the work group is going to come to a close towards the end of this year. We'll publish those results. Phase 3 will start in earnest in the beginning of the new year. The goal, again, assuming a final rule is published, review the rule. How did it change from the proposed rule? Now that we have more certitude as to what's happening, talk about the implementation plans, talk about compliance, and really convene and inform all of you and the ecosystem as to how to navigate through this landscape. So my final words would be sort of a call to action. Please engage with us. If you have questions, if you have comments, please email. All right? Look at the output of the work group. Join the Leadership Council of Interoperability Matters. We have public calls. Please join and listen in and ask questions and comment. We certainly will benefit from your participation, and I'm confident you'll benefit from the information that Sequoia is making available to all of you. So with that, I think we have a few minutes. If anybody has questions, I'll stand up here and moderate a little bit, I guess, but if anybody has questions. Stephen?
Good morning. Is this on?
Yes.
Great. You talked in one of the later slides about the opportunities provided by this. Clearly, as a provider organization, we feel that we suffer somewhat from the blocking of information by other entities with which we interact. So potentially, this rule will open up new sources of information for us and new opportunities for us to do more for our patients, our providers, our communities. Has the work group discussed that at all? I mean, a lot of this is coming from a kind of a defensive posture, as how are we going to respond to this as potential, organizations. But what about the opportunities? Have you looked at that?
Go ahead. It's a recurring, in generating the recommendations that come out of it, that hasn't translated, but the discussion, it comes up. Because in my mind, when we're talking about it, and I say, the same sort of thinking about, we're thinking about how do we prepare so that we're not called out on it. It's also coming from a provider organization that engages in a lot of information exchange. The essence of this, the spirit of it, is coming from a long history of bad actors not participating in it. So this is really about, I think it still comes from that source. In terms of specific opportunities, I'll defer to
And I just add on, and I think, by its nature, you're reviewing a regulation. People do tend to look at the risks of it. But I'd say one of the thoughts just throughout the discussion, I think it was extreme, is people actually will, the people who are participating, they're committed to data exchange, they want information to be available. And I think that, as you'll recall, I mentioned with the thought of taking a higher level approach to the price regulation, that the more these regulations are manageable, the less they impose a costly burden. In a sense, it will free up time and resources to actually focus on doing the right thing, on meeting your customers' and stakeholders' needs, on making information available, as opposed to investing in compliance and implementation. So I think that there's definitely, this is the law of the land in 21st century cures. We're going to have regulations. And in that context, I think there's a view that if the regulations are more practical, that their goal will be achieved. And I think as well as we actually have a final rule, Stephen, that it'll also provide an opportunity to turn more to how do we actually make this work for the benefit of the community. So, but it's a great perspective and one that we don't want to lose sight of.
So I had an additional follow-on question, which is, obviously as the rules come out, we'll all be in this sort of defensive compliance posture, which is understandable, but we'll also likely be looking around and seeing where others in our community or in our ecosystem that we feel that they may be blocking information. How do we, if we perceive ourselves as victims, if you will, I don't like that word, of information blocking, are there any suggestions as to how one might proceed to try to remedy that?
I mean, I'd say one first thought, and I'll turn it to Steve as well, is talk with them. And I would, again, that's sort of where I came down from my analogy to the medical malpractice kind of risk management. My own personal sense is I would not start a conversation with tossing down the information blocking card, but focus more, I mean, people are going to understand that's the concept, the context, but to focus on what you're trying to achieve as one of their partners or potential partners. And I definitely think that, because it's going to take a time for any given compliance action to work through. That's not an efficient way to achieve a business end. So I'd say with the recognition that now this is the new reality, I'd say have the kind of frank, and I think, again, my experience as well, as I'm sure you've seen it, is face-to-face is better than email, right? And have that conversation to try to achieve your needs mutually, rather than going explicitly to sort of the mattresses, to the information blocking. Because I think everyone's going to be in a new environment, and if they don't realize it, they're going to realize it pretty quickly.
I anticipate that OIG will be publishing some type of guidance on reporting. I don't think that will require rulemaking, but or they'll signal to the industry, that OIG already has a very robust mechanism for reporting. So for that part of your question, I think the industry will be made aware of how to pursue that.
Sir. Good morning. So as a provider organization that currently participates in eHealth Exchange and Care Equality and has EHR technology that has open APIs connected to Apple Health Kit and really gives patients access to their data, give me a sense of the baseline of things that we should be looking at for connected organizations that might make us susceptible to this information blocking rule, because I feel like our organization is very open and very connected, but I'm looking at that next layer, right? So what should we, as from a planning standpoint, as an organization that's very connected and open with Exchange, should we take as a next step for making sure that we're not part of that or concerned?
So a couple things to do is I would look in certainly the proposed rule, but definitely the final rule, at the practice examples. Because there's page after page. See which of those apply to your type of organization. That would be kind of a first thing to do, because remember, it's two steps. It's, are you information blocking? And then if you are information blocking, does one of the exceptions apply? So first I would try to understand actually I'd step a level back. What are the things you do that are interoperability elements, right? Because those are the things that could block. Secondly, which practices are relevant to you? And then I would look at the exceptions. So for example, on the pricing exception, even if you're doing everything, your whole stance is to make information available, you're still going to need to make sure that your pricing meets the exception. Another one, which I think, again, will be something to miss, is there's an exception of, I think it's the last one, having to do with data availability or unavailability. So basically, if you have a relationship with somebody, let's say you have an exchange process, and you want to go down, let's say, to take it down for maintenance. Unless you've got a service level agreement that addresses when you can do that, the way the exception works, so going down for maintenance is not information blocking, you'll need to have the permission of your your client, let's say, on each and every instance. So making sure that your SLAs make that as kind of a, so you don't have to do an event by event kind of permission. So that's the kind of thing that's very granular. That's why you'll want to, even if again you're doing things sort of perfectly, you're still going to want to scrub through the exceptions. And as Steve said, make sure that you've got policies and procedures that make sure you're complying. And again, that's going to be the key, I think, to keeping the costs down. So we're not dealing with this on an ad hoc way. That you figured out what you need to do given your circumstances, and you have policies and procedures to make sure people are doing that. So it's a great question, but it also illustrates, even for people who are as far from bad actors as possible, there's still going to be things that need to be done.
There's another question.
Good morning. My name is Jill DeGraff with Aperture Law Group. First of all, I'd like to challenge the concept that there aren't enough qualified lawyers who can help.
I'm sure there are many, but
Number two is to go to the idea of business opportunity. The idea around compliance is very on your heels oriented, but we're really moving towards an era where data is an asset, and it can't be an asset unless it's categorized, classified, organized, owned. And all those components of information governance, if it's not already done, should be like one of those first steps in your project, I would think, and I'd love to hear how you might respond to that.
I'm sorry, what's the question though?
Well, I guess the first question is, to what in your observation in the marketplace, to what extent do you think there is a mature information governance framework in most actors, most healthcare providers in particular? Because if it's not mature, then it needs to be mature not only for compliance purposes.
Really important point. The whole idea of data as an asset, I have to admit, gives me some heartburn. Because I've been in more conversations than I can even remember where folks have said, well, data is our key strategic asset and we will protect it at all costs. And so I'm a little worried about us thinking about our patients' information as our asset. So let me start there. However, getting over that, in my experience, I think that most all of the actors already have information management frameworks and information management practices. They're vastly different, whether you're a health system or a health plan or a large vendor or an API developer. They're vastly different, but I think if you're in the information business, you're going to have that framework in place. So I don't think we're talking about starting with a greenfield. I think what we're talking about is sort of how do you incorporate information blocking into what you already have so that it doesn't sort of get lost, in the process. And I don't necessarily see it as putting organizations on their heels. I view compliance as proactive, not as reactive. That's just my personal perspective. And so to me, it's part of business sustainability. Your compliance program is part of your sustainability efforts.
And I would just say that information governance, which is a defined domain, absolutely should be part of the implementation plan. So I think that's a great point.
So on behalf of David, Mark, and Steve, and of course Mary Ann, I'd like to thank you for your time and attention. I think we have a 20-minute break coming up, so thank you very much.
Good job.